Okay, welcome back to Crush Medical. We've got another high yield gastroenterology question that students mess up all the time. So let's break it down. If you find this video helpful, make sure to like and subscribe to the channel. Helps us grow, and we're going to keep putting out a lot more free content for you guys. Okay, so let's jump right into it. A 25-year-old man reports a few weeks of bright red blood on the toilet paper and sharp pain with bowel movements. He is afebrile and hemodynamically stable with no weight loss, anemia, or change in bowel habits. What is the next best step? So let's quickly just unpack the clinical picture one more time. We've got a young male, right? He's not exactly 60s. We've got a 25. So that definitely points us in certain directions in terms of presentation and the type of diagnosis we could be thinking about, right? And he's describing bright red blood on the toilet paper, essentially after wiping, after he's passing stool. And he does describe sharp pain with bowel movements as well. So painful bowel movements and bright red blood. Outside of that, he's actually no fever. He's stable. It's not like he's dealing with an acute bleed of some sort and bleeding out. No weight loss, no anemia, or no change in bowel habits. So right off the bat, we can kind of say that dealing with the blood on their toilet paper, he seems relatively stable, right? So let's kind of go through the options and see which ones applies best for this patient, okay? Let's start with option E, endorectal ultrasonography. So essentially getting an ultrasound to see if there's any obstruction, anything of that sort. So in this case, it's incorrect here. It's a big time distractor used mainly for staging anorectal tumors, right? So not the initial evaluation of likely fissure-related bleeding. So in this case, ultrasound, you going towards imaging is just not correct here, okay? There's other things that we can do before we jump right into imaging, whether that's ultrasound, CT, anything of that sort. Just incorrect as a first line, okay? The next option is the fecal immunochemical testing, also known as the FIT test for stool, to determine if there's blood in your stool. This is another good option here. It's a distractor, right? So FIT describes the occult, invisible blood that you can't visibly see. That's why we do a FIT test, right? And therefore, in this case, it's just not correct, right? And FIT tests, usually we do this for more for colorectal screening and more preventative care. Whereas in this context, we're dealing with a patient who has bright red visible blood on toilet paper. So we're not exactly screening this patient. We're trying to directly see what it is that's going on for them. So in this case, D, fecal immunochemical testing would be incorrect as well, okay? Option C, so flexible sigmoidoscopy. This is a really interesting option. You're basically essentially scoping them to see if there's any underlying pathologies contributing to this bleed. So let's just see. In this context, it's incorrect here, right? So may follow if symptoms persist or if the anorectal exam is unrevealing. And again, it's just not a first line approach, right? So when you're evaluating any bowel concerns, GI bleeding in this case, um, what this patient is describing sounds very fissure related or hemorrhoid related bleeding, as opposed to any underlying GI pathologies like diverticulitis or any Crohn's disease, which can cause these bleeding concerns, similar to what we're kind of experiencing with this patient. So in that context, you would want to scope them, right? But for our patient, it's just not the best next step. So therefore, it is incorrect here. Okay, that brings us to option B, which is digital rectal examination. And in fact, this is the correct answer here, right? So now we can just have a high yield chat about this. So this patient who's dealing with bright red blood on toilet paper and is otherwise healthy and fine, again, we should be thinking of things like any fissures as well as hemorrhoids, which are the most common causes of this type of bleed that you can actually experience, along with sharp pain with bowel movements, right? So in this younger patient who is again stable and has this outlet type of bleeding, it's not necessarily a deep internal bleed, right? Outlet type of bleeding with painful defecation and no alarming features. The first thing we can do is essentially a bedside exam, and you're looking for an anorectal source, right? Whether that's fissures or hemorrhoids, we can quickly identify this, right? We don't need to escalate to imaging or any scoping procedures. This is something we can just do right away at bedside and come to a conclusion, right? And again, no alarming features, and the big high yield bullet is just to always go with digital rectal examination for board examinations, okay? simple, non-invasive, and immediate, okay? And therefore that is the correct answer. And last but not least, we also have colonoscopy, which is very important for boards, of course. So there's a lot of uses for colonoscopy. In this particular patient, though, again, we just mentioned that digital rectal exam based on what we think it is, whether that's a fissure or hemorrhoid. Colonoscopy is an invasive diagnostic procedure. It's a lot more for staging as well as screening. And in this case, this patient has no red flags, right? If they had weight loss, iron deficiency, or even an elderly patient, and they have persistent bleeding that's just not resolving, or some concerns that like a positive fit test, or concerns that they have some deep internal bleeding or cancer or any concerns like that, that is when you'd push straight for colonoscopy. But in this patient who is a 25-year-old male with just some bright red blood and otherwise normal, incorrect, okay? High yield question, make sure you don't miss this because this concept pops up over and over again. And if you jump into imaging right away, then the boards are going to get you, okay? So if you like this video, you found it helpful, make sure to like and subscribe, and we'll see you again in the next video.